Since COVID-related restrictions were lifted, China's mainland is seeing a surge in cases, with Beijing bearing the brunt. As people brace for infections, some hospitals are apparently getting overwhelmed, and medical supplies are being stepped up urgently to meet soaring demands. Elderly population, especially those with underlying conditions, are facing the biggest challenge. What are being done to address these issues? What useful experiences can be borrowed from other areas in the world that went through this phase, and what must be the priority going forward? Today, I'm pleased to be joined from Nanjing, southern China, by Zhiwei, professor of the Center for Public Health Research at the Medical School at Nanjing University, from Shantou in southern China's Guangdong province, by Dr. Zhu Huachen, associate professor from the School of Public Health at the University of Hong Kong, and also with the State Key Laboratory of Emerging Infectious Diseases, and from Shanghai by Dr. Zhou Tai, traditional Chinese medicine doctor at Body and Soul Medical Clinics. The warmest welcome to all of you on the point. So Professor Wu, let me go to you first. I understand you're just coming out of COVID. Indeed, over the past few weeks, we are seeing cases soar across the country, and some hospitals are reported to be under great strain with people with underlying conditions, and especially elderly people desperately needing for help. So what are the biggest difficulties right now from your observation for people on the mainland?
Well, I think it's critical that people need to make sensible, rational decisions when they start going to the hospitals, such as in my local hospitals. You can see that a lot of people with fever and some very minor symptoms, they flock into hospitals. So that's why the fever clinics are full of people. So the nurses and the doctors, basically what they are doing is trying to persuading and sending those people back home, because there is no need to seek medical assistance. If you do not suffer severe symptoms, then you don't need to go to the hospitals. Only when you are having, some basic medical conditions and running a very high fever and some complications, then you need medical assistance. So this is something actually you can do to relieve the health service for really needed people.
Yeah. What is driving these people to flock to the hospital immediately, especially elderly people? As I said, the moment they catch the virus, they go to the hospital. What are the reasons behind this?
Well, I think partly it's a kind of a panic reaction. You can understand that because once we, open up the society without, taking nucleic acid testing, and the pharmaceutical stores running out of all sorts of medicines, people just, when they catch COVID-19, their first reaction is, okay, let's go to a hospital, get the medicine, get assistance.
Dr. Zhu, from the experience of Hong Kong, we understand that Hong Kong had a peaking experience in the beginning of this year, which lasted about 1.5 months to 2 months before the curve was eventually bent. According to your understanding, is the worst already over it, or is the peak of the wave still to come for cities such as Beijing and other mainland cities?
I would say that about the lessons learned from Hong Kong. Obviously, back in January and February, Hong Kong was not yet ready to face the big outbreak. Underestimation of the virus transmissibility and the impact and misconception that the conventional control measures used for Delta or the earlier variants could work for Omicron, and repeated spillover of viruses into the community have put Hong Kong in this kind of strengthened circumstances at that time. And at that time, the government and hospitals had no clear guidelines for those who get infected. And what should they do to avoid infecting their family members, to relieve their symptoms and to seek for help? There's no answer at that time. and also how to adapt the previous triage system to the COVID-19 outbreak, and ensuring the sufficient beds, wards, and facilities for those who really needs them. These were also the major problem that we are facing nowadays. So I would say that for Hong Kong, because we have already experienced the major outbreak wave caused by Omicron, and the majority of the population has already been immune either by vaccination or infection itself. So I would expect that in the near future, there would be some kind of small waves of epidemic, but not as strong as the spring outbreak.
But what about the mainland, for instance, Beijing, which is, seeing cases skyrocketing at this moment?
Yes, I would say that actually China is kind of facing a nationwide tsunami caused by COVID-19 nowadays. And the overwhelming attack by multiple strains of Omicron in mainland China has obviously caused huge pressures on medical resources. So because we are also not that ready for the pandemic outbreak here, and people are queuing up at the fever clinics and the drugstores to get medicines and medical services. But however, the doctors and the healthcare workers, they are also getting infected. And many hospitals are now battling the staff shortages. So I think that the situation in like Beijing, Guangzhou, Shanghai, these big cities are not that, the situation here is quite severe. And I think that probably China, and especially the government, has to encourage the pharmaceutical factories to promote or increase their production capacity within the short period of time, and also try to coordinate the distribution of drugs, diagnostic kits, and the medical service to those who really need them.
Yeah, well, I understand. I was just watching the news this morning. Pharmaceutical companies, especially those that are capable of producing drugs to cure fever, to stop pain and stuff like that, have been urgently stepping up their production capacity to meet that kind of need. And I suspect other measures are being made. But let me go to Dr. Tay. You are a practitioner. Are you seeing in terms of the surge of cases and how the communities there, or how hospitals there are coping with the situation? Of course, I understand you're not with a public hospital, but just from your knowledge, what is happening in Shanghai?
Well, currently, obviously, we have an outbreak because we just eased up the measurement recently. So we can meet like a lot of people are having mild symptoms like sore throat, fever, and coughing, and they are advised to do the self-quarantine back home. But on the other hand, we are also facing some shortage of certain medicine in the pharmacy store. So people will try to reach us, like from my clinic, people will try to reach us and ask for some help for the medicine. And we'll try our best to approach them in the lowest risk, as we acknowledge that people are getting positive everywhere now. So I believe that different provinces have different measurement in place already, and so do Shanghai. And I've seen the community already pushing some policy that try to urge the elderly to have the vaccination also. I think this is the crucial part because they are the vulnerable community. So
what about traditional Chinese medicine? How helpful is that?
Okay, so traditional Chinese medicine, based on the scientific research back in 2012, there is a paper stating for the SARS, it's not even the COVID now. Back in the time, we already proven that by combining Western medicine together with Chinese medicine, we can enhance the quality of life of the patient after they got infected. And recent years, more and more research papers showing that the Chinese medicine can some sort of regulate the immune system for us, and then somehow can regulate the ACE2 path, as we know that like one of the mechanism virus attack our body is go through the ACE2 protein to attack us. So the research shown that like most of the antivirus prescription that we are using on our patient, they have some sort of regulation function on this to try to control the symptoms and ease the symptoms for us.
All right.
Yeah.
Well, one of the biggest issues is tracking. Obviously, China loosened the tracking system, and right now it's only reporting something like 2,000 to 3,000 new COVID cases daily on the mainland, which is obviously not a reflection of the accurate situation. Professor Wu, what is your thought on this? Is it important to have a tracking system in place still to understand the situation more accurately and more globally?
Well, I don't think it's necessary to keep tracking as what we did in the past, because basically that sometimes exacerbates the situations and all the local government actually doing kind of, over control and over restrictions. What we need to do is focus our effort in the severe cases, in the elderly people who actually are most vulnerable.
But how do you do that? To have a voluntary report system or from hospitals?
Well, the voluntary reporting system will never work. Basically, I think, only when you establish a system, when you have severe cases, when you have severe complications and the death in the hospital, and it has to be mandatory system. So you get a exact or precise numbers.
It has to be done by hospitals.
Exactly, yeah.
Okay.
Not by individuals.
All right, Dr. Zhu, what has been the experience of Hong Kong? As I understand, Hong Kong is still calculating the cases and reporting the cases to understand the development of the situation. What is your opinion?
I would not say the number of reporting cases in Hong Kong is very accurate, as we know that many people, they are asymptomatic or undiagnosed. But these kind of numbers can still reflect the severity of the epidemic to some extent. Genotyping and sequencing can also inform us of the virus variation, development, and evolution. And I think that is also quite important information for us to better know about the disease development. And my recommendation is that actually we can conduct some kind of surveillance and by using random sampling in the community and also the clinic. Then we can sequence the samples, especially those positive samples, to understand the positive proportion among them, and also the genetic diversity of the viruses. And I agree with Professor Wu that with the huge population in China and the relative paucity of resources, I would not recommend the mandatory reporting of those positive cases. I think that we should save the hands and resources for disease management and also the treatment of those people with other kind of underlying medical conditions, especially when there's a squeezing in the medical resources.
The question, or one of the paradox, is you want to have as many infections in a short period of as possible, so that very fast you're going to have that kind of herd immunity needed to slow the spread of the virus. But on the other hand, the medical system, if everybody getting sick at the same time, will very likely be devastated, be overwhelmed. So how do you look at the delicate balance between these two factors, Professor Wu?
Well, I think, it's critical that our pharmacies should stockpile those necessary drugs, medicines, such as fever medicines and coughing relief medicines. Basically, I just went around, I found that almost all the pharmacies just simply run out of those medicines. So that's why people just flocking into hospitals and make hospitals so crowded. I think it's critical that allow people to manage the disease themselves when they are not in severe cases. So this is, I think we need to do it desperately in a relatively short term. Like in Nanjing, you can see that there are a lot of people getting infected. In my laboratory, all around 30 students are infected. That's a good indication how widely the infection is.
Hmm. Do you see measures being taken in that regard to distribute symptom relief medicine to those infected but not severe?
Well, I haven't seen any improvement in terms of preparedness. This morning I went around the streets. You can see that the pharmacy is still with a long queue, and I asked them that well, basically there are still no medicines available or very limited stuff available. So I think that's a real problem. I think the local authority should be able to deal with.
Yeah, well, there's certainly a time gap in terms of picking up the supply to meet the soaring demands. I was at a pharmacy 3 nights ago. Fortunately, I was able to pick up some fever medicine, but obviously it is in short supply, as you can tell from.
You can't even find a thermometer.
That is, well,
yeah.
That is also for the people who have not prepared over the past 3 years, it is going to be in short supply for the moment. So, Dr. Zhu, did Hong Kong also experience these various difficulties when the wave came? How long did it take till things eased up?
I think that the Hong Kong government has already started the preparing the stock for the vaccines and also the drugs long before the outbreak happens this year. So in general, the drug availability in Hong Kong seems fine, but the problem is more related to those hospital wards and the sick beds. So after getting some support from the central government and building up of those so-called fountain cabinet hospitals.
Makeshift hospitals. Yes.
So actually, it is much better for the hospitals to accommodate patients. And nowadays, whenever you report the positive case to the government will directly send you an anti-epidemic package to you, including some OTC drugs, some personal protective equipments or devices, and also the rapid antigen detection kits. So I think that most of those infected people, they are no longer that anxious or fear of the disease. They have those drugs that is necessary to relieve the fever. And also they can do the daily detection by themselves at home. So I think that actually would be a good experience.
Well, that's a few months after the shock came over Hong Kong. Obviously, people had enough time and the authorities had enough time to adjust their policies. But in the 2 months where the situation was the most severe, there were over 7,000 people who died either by COVID or with COVID, and most of them elderly people. Do you foresee the mainland being hit by, such heavy loss of lives by such a magnitude? Dr.
I would say that probably the situation in mainland China would be a bit better than in Hong Kong, because during that time, the vaccine coverage in Hong Kong is pretty low, especially in those elderly people. So within these past several months, mainland China has actually already learned something from Hong Kong, and promotion of the vaccination has actually get a better coverage in the population. And I think that because in most of the cities, they have already getting prepared for at least a tsunami of the outbreak. So people, most of the families, they have already get some drugs. And also nowadays, people, those infected people are allowed to have the home quarantine and also have the self-detection by themselves. The situation is not like what happened in Hong Kong at the very beginning, because at the very beginning, people are really rushing to the hospital to get help there.
Well, the number of elderly people is still very high. 1/5 of the population is over 60 in the mainland. Dr. Te, from the experience of Malaysia and also from what you saw here in China, you've been practicing in China, in Shanghai for the past 4 years. From your understanding of the Chinese mentality and of the preparedness of the city, what is your estimate of the situation to come?
TCM has been using for 1,000 years. So back in 1,000 years ago, we don't have all sort of lab tests, all sort of like MRI, or we don't even have electricity at that time. So the way that the people back in the time to deal with the contagious disease that we had, such as like the COVID, back in the time we don't have the virus term. So they try to categorize all the symptoms for the patients into some categories in order for the physician to prescribe the prescription accordingly to the categories, and those prescription is still being used even now for us to fight with the COVID symptom controlling.
Yeah. So, well, actually, the numbers, I would bring people's attention to the numbers of COVID situation in China in 2021. I understand China had tens of thousands of COVID cases, but only 2 deaths. So the Chinese way of treatment, combining Western and traditional Chinese medicine, could be helpful. Professor Wu, what is your take?
Well, I think, I'm a little bit, optimistic, although we have a large number of elderly people and people with underlying medical conditions. But over the 3 years, I think we are relatively better or prepared for the COVID-19. The other thing is that overall, the elderly's vaccination rates are relatively high. Right now, for those over 80 years old, the vaccination rate is about 67%. So that's not, satisfactory, but it's not low either. So if you look at the beginning of December, apparently the country is picking up the vaccination in this particular population. I think it's very critical right now. So the previous outbreaks in various different cities is a good example, or if that's a good indication, then I would be optimistically thinking that the death rate would be can be controlled in minimal numbers. The thing is how the hospital is going to manage those cases and deal with all the necessary medicines, drugs.
Right now, it's the most difficult period of time, because although vaccination among the elderly, among the 80-year-old and beyond are picking up, it's going to take some time before their antibody develops to the level that can help them resist the virus. Meanwhile, the hospitals are already full with people who are not very severe, and medical staff are infected as well. So is that the combination of difficulties we are seeing at this moment, Professor Wu, once again?
It is definitely a complication, which actually makes the situation rather difficult. I think a couple of other things we should do is that I know that some hospitals stockpile the Paxlovid drug, which is a very effective drug in dealing with the infection. the country, I think, should import more Paxlovid and stock up in various different hospitals in case when you desperately need it. Of course, the Chinese medicine also is a way to go, but the Chinese medicine, of course, only relieves some symptoms. So this is something actually we should consider the Western and the Chinese medicine combined to see. Those are the life-saving drugs. We need to get prepared for the outbreaks.
Dr. Zhu, what is your understanding of the medicines or the combination of medicines that can be used? In Hong Kong's case, how did people mix these two, and what is the role of imported drugs such as Paxlovid?
I would say that during the big outbreak in Hong Kong a few months ago, it is obvious that after receiving the support from the mainland China, the medical doctors actually provide lots of therapy experience there. And I know that actually, like in Guangzhou, in the past 3 years, there's only one single death in Guangzhou. So that actually provides solid evidence that our doctors, they have all the experience and knowledge about how to treat even those very old and very severe cases under the condition that there's no staff shortage or like the medical run.
Right.
So I think that the combination of the traditional Chinese therapy with the more the molecular antiviral drugs would be a good options. And we all know that like Paxlovid, this kind of oral drugs, they have solid evidence that they can inhibit the virus at least for a period of time. So it can help to relieve the symptoms and also reduce the virus load during the infection.
Yeah. Well, it's a much more complicated issue than that. It also, about financial resources, because obviously the imported drug is very expensive here in China. Sells for over 2,000 yuan. That is $300 for something like 10 to 20 pills. Definitely. Right now it's not available, but I understand the Chinese factories are also producing their own antiviral drugs to deal with COVID. I'm running out of time, but I do want to say these are individual perspectives from our guests and the numbers, because this is a discussion, so we cannot guarantee that every number quoted is absolutely accurate. We advise our viewers to please double check with the sources while we try to make sure that we give the complete and accurate picture as the best to our abilities. So we are going to wrap up, and we're going to keep a close watch on the situation and keep our audiences posted. Many thanks to Professor Zhiwei from Nanjing University, Dr. Zhu Huachen from the State Key Laboratory of Emerging Infectious Diseases, and Dr. Joe Tay, Traditional Chinese Medicine Doctor, joining us from Hong Kong.